Good morning, all. I'm with Catherine Brennan from Education, who's an Executive Director in Education. Our Minister for Education, unfortunately, is in forced leave because of family members with COVID. She would have liked to have been here because this is a big issue for education. And Dr. Marianne Gale, who's off the back there. Dr. Marianne Gale, of course, is the Acting Chief Health Officer in the absence of our wonderful Chief Health Officer who's having a break at the moment. I want to start by just acknowledging that the community would have seen more and more young people using vapes. We are very concerned, that is the government and New South Wales Health and Education are very concerned about the impact of those vapes on young people's lives, but particularly on their lungs and on their health. What we know is that there have been surveys done that indicate that across the globe that a lot of young people don't know, in fact a lot of older people don't know, just how damaging vaping can be. In fact, often, as you would appreciate, it's seen as a better alternative to smoking. In reality, it can do an enormous amount of damage to adult lungs, but the concern is even higher for developing younger lungs for our children. Today, the New South Wales Government, Education and Health are launching a joint campaign, an education campaign, to get the message out to young people but also to parents, to carers, that vaping is actually quite dangerous to young people's lungs. Some years ago, when I visited one of our major respiratory research centres, so a research centre that looks after people's lungs, one of the very senior researchers advised me that vaping products are using chemicals that we find in antifreeze, but dressed up in 500 different flavours to make it acceptable. I can only say it is a cynical exercise by people who produce these vaping products and vapes, and it is extremely dangerous to youngsters' lungs and their general bodily development. This campaign is certainly aimed primarily at educating, but it's also about hoping that we might be able to deter young people and young people from actually using vapes. Sadly, it's become, on the face of it anyway, cool. It isn't cool. It's actually pretty foolish to be using vapes. We also know that it's very difficult to stop these devices entering the country because at the present time they can be ordered online from overseas. And of course, the one thing worse than the 500 different flavours of antifreeze chemicals that people are putting in their lungs is also whacking in some nicotine. Now, that is absolutely illegal in this country, but for children, for young people. And of course, nicotine is extremely dangerous. Unfortunately, it can be ordered online as well, and is brought in, we understand, from jurisdictions not that far away from us. So we do need to effectively empower our residents, our citizens, to understand the dangers. And that's the purpose of this campaign. Teachers, of course, in schools will be empowered with the information material that Education and Health will send out to them. I know that teachers do a great job generally advising youngsters on the dangers of drugs and alcohol, and certainly would be generally giving them the advice on vapes, but of course they need the materials to be able to give the full details. So with this package of information that will go to our teachers, we're empowering teachers to empower families to actually make sure there's a partnership of advice to our youngsters on the dangers of vaping. Now I'm going to ask Dr. Marianne Gale, in her capacity as the Acting Chief Health Officer, while Kerry Chant is on leave, to be able to just give us some more detail on that. Then I'm going to ask Catherine Brennan, who will be filling in for our Education Minister today. She's an Executive Director in Education and is very across the issues. So, Dr. Marianne Gale.
Thank you, Minister, and good morning, everybody. New South Wales Health has developed this campaign really out of concern of the increase in numbers of young people that we are seeing taking up vaping in recent times. And as the Minister has highlighted, we are concerned about those health impacts on young people and really seek to engage with young people and with families and with teachers and the school communities around this important issue and make sure that people have the information they need to make good decisions. We know that amongst many young people, e-cigarettes or vapes are considered safe and certainly safer than cigarettes. We know that for many young people, because vapes can taste nice, they have a sweetish flavour or fruity flavours, they're often in quite attractive packaging, looking like things that students would normally use, like a USB key or like a highlighter. And the vapour that they produce is often perceived to be a water vapour and therefore potentially perceived as harmless. However, it's very important that young people and families understand that e-cigarettes are not safe. They are still relatively new products to us in our community, and we're going to need time to work out a fuller understanding around the health impacts. However, what we know now, what the evidence tells us now, what the experts tell us now is that these products are not safe. And there are a range of health harms that are associated with vaping. And I know that in this space there are some contested issues, but the firm view of New South Wales Health is that e-cigarettes cause health harms, and we really want to engage with young people about that. Some of the health harms we know that e-cigarettes cause can be immediate effects when vaping, such as heart palpitations, chest pain, irritation to the throat and the lungs. And these are all effects that can be seen acutely on using vapes. We know that the effects of nicotine itself is highly addictive, and I'm sure that none of us want to see our young people addicted to any substance, let alone nicotine. We know that nicotine, in addition to being addictive, has severe and negative impacts on the developing brain. And young people's brains continue to develop into their early 20s. And we know that nicotine is associated with impacts on memory, on impacts on attention, and impacts upon mood that can affect young people's mental health. In addition to the effects of nicotine, as the Minister rightly noted, vapes have a whole variety of additives and chemicals that are not intended to be breathed into anybody's lungs, let alone the lungs of young people. And those additives can range across a whole number of substances that can be found in products like nail polish, in bug spray, and in detergents. So we're really concerned about the impacts of inhaling those sorts of chemicals that can be associated with lung injury, and we have seen instances of that occur. We also know from evidence and studies that have been done that vaping increases somebody's chances of becoming subsequently a smoker. And that increase is around 3 times, so 3 times more likely to become a smoker if you have been vaping. So it's really important for young people to be aware of those key messages and to have a conversation, for us as health, to have a conversation with schools, the school community, families, and with young people about those issues. And this campaign is really the start of that ongoing commitment that we have to addressing these issues and reducing the health harms of vapes on young people in New South Wales. Thank you.
Good morning. I'd like to acknowledge the traditional custodians of the land where we're meeting this morning, the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging. Minister Hazzard, Dr Gale, Cathy Brennan, I'm Executive Director School Performance with the Department of Education. The Department of Education welcomes this partnership with Health, where we can provide a really clear and strong education program to support our teachers, our parents and broader community. As we're aware, the vaping has increased not only in our schools but amongst young adults as well. We are very concerned about ensuring that we can provide for our schools, our parents and our broader community current information that supports them to have the conversations they need to with young people. A preventative and proactive approach to vaping education. We know that in schools there is a growing concern for teachers and for parents about the use of vaping, and we are so pleased to be able to partner with Health and to provide information not just to our secondary schools, where we will certainly provide a focus, but for all of our schools, our teachers, our principals and our school communities. By providing the facts, we know that we are making it easy for those conversations to outline the risks associated with vaping. We do know that our students, our young people, do believe that vaping is safe. The marketing is not helpful, and we need to make sure that we provide the facts that vaping is not safe. It does not provide our students with a safe environment if they're vaping, whether at school or anywhere else in the community. So again, reiterating, this is an education opportunity for us. We will make sure that the information is provided, targeted not just for in the Department of Education, but for all schools. As a resource, it will complement the resources already available to our teachers in the drug education curriculum, and will provide, again, contextual Australian-based information that can support the information being shared with our broader community. We really encourage parents to be talking with their young people about e-cigarettes and vaping. We will provide the information to parents through our schools, but we also urge people to have a look on the Health website at the information that is now available in relation to vaping. Thank you, Minister.
Questions or comments?
This is aimed at high schools, but you mentioned in the inquiry in the estimates the other day it's happening in primary schools. Why not primary schools?
You're listening to estimates. That's very good. Excellent.
A whole lot.
Look, Health has actually focused on the research that they've managed to obtain for young teenagers, but the actual education campaign, the tools that are being given to the schools apply to all ages. So this information will be available also to primary school students and to their parents and, of course, to their teachers. So it's a campaign that will run right across the entire primary and high school government and private students across the state. But certainly the information and the research that's been done has been primarily in that target audience of the 14 to 17-year-olds at this stage. But there's going to be a lot more work done on this in coming months to expand the campaign.
Is there any move towards escalating what can be done from enforcement route to banning e-cigarettes?
Yeah, given the choice, I'd love to ban them, but it really does require a national approach, and I think that's been challenged at various stages. There are some people who still think that it's a great idea to be able to vape instead of use a cigarette. Wrong. So we need to actually just make sure that we get the education campaign going. But enforcement, there are restrictions on retailers being able to sell these things. And I think in the last 15 months, there's been $2 million worth of vapes and vaping products actually taken away from retailers. About 150 retailers have lost $2 million worth of product. And certainly the instructions I've given to New South Wales Health in the enforcement area is to collaboratively go about trying to talk to people to get it right first, but then hit them hard if they're not actually responding appropriately. Sorry.
How common is vaping among school students? Do you have an idea of how common it is? And is it a bigger problem than cigarette smoking?
I'll ask Dr. Gale to comment on that, but can I just say, as a local member of Parliament and as a minister, I've had so many reports of kids arriving at school with vapes and thinking it's okay to vape, and it's high schools, it's primary schools. My message to parents is I remember when I had younger kids, it was a pretty tough act to try and convince your children not to do whatever they wanted to do, particularly with peer group pressure. But this is one where it's worthwhile getting the education, getting the opportunity that Health's given you to really know how to approach your kids and try and encourage them not to vape. Cigarette smoking, vaping, it's all dangerous. The little kids' lungs are so, and as we just heard, the impact of nicotine and other chemicals on the development of the brain. It really is a huge problem. So it's about time we all got on with the journey of saying vapes are not good. Having said that, as I walked down here today, I saw health staff vaping. The problem is everywhere. It needs to be a consideration of adults as well. What you do in your home and what you do with your children, in the presence of your children, is modelling for them as to what they're going to do. So I'd certainly be encouraging parents to have a good think about it. If for some reason you're already addicted to using these stupid devices, then don't do it in front of your kids.
The government has had campaigns before in decades past to reduce smoking amongst teenagers. Why do you think this vaping campaign is different, and how do you think it's going to happen?
Actually, smoking overall in the community has quite dramatically dropped in the last 15 years, and campaigns have a place. Is it the only thing we can do? Probably not, but we've got to start somewhere in terms of actually reaching out to the schools where it really is. Unfortunately, the schools have become a crucible on some views as to the smokers of tomorrow. So if our schools are struggling, and I know principals have said to me that they are struggling to manage this issue, we need to give 7 years has collapsed. That's all right. It's going to collapse again, but we'll fix it. You can rely on 7 News' microphone and the news from 7. Would you like to sing into it or something? Okay, back to the... Look, obviously doing nothing is not an option. Getting the education campaign into schools is one part of our response. There's the obviously enforcement agencies who are going through various retailers and making sure they're complying with the law. And as I said, $2 million worth of product gone just in the last 18 months from 150 different retailers, and that's not going to stop, that's going to increase. So I must say, those who think vaping retailer is a good business to be in, I'm hoping it won't be in the near future.
Minister, just on COVID,
Ash.
what do you think? There's a number of schools, especially independent schools, who are trying to take matters into their own hands with the current uptick in cases.
Yeah.
And they don't think that the government's plan or the plan that's possible is enough. What do you make of that?
Yeah, look, what I would say is what I said last week, and that is that the University of New South Wales researchers who accurately forecast back in December that we'd be sitting at 25,000 cases a day during January have given us some more information. And that information is that we could see an uptick quite substantially very soon in COVID cases, and that by the middle of April we could be looking at double the number of cases we've got now. Last time they forecast the 25,000, they were light on. I fear they might be light on this one too, because certainly we're seeing in the various health facilities, we are seeing people presenting. I'm looking at those numbers. I've asked Health to double check the numbers and make sure that we're getting all the cases. Part of the problem, of course, that immediately becomes obvious is that in the earlier stages we had absolute accurate, well, we were as accurate as we could be because we had PCR tests. They were not being done at home, but you'd remember that in December, January, we moved to rapid antigen testing and self-administered testing. And whilst there is a penalty, it's not a penalty for not reporting the results. We can't be absolutely certain that that's happening. So I think we've got to take seriously, even if there's a current mismatch between what we're seeing on the ground and what they're forecasting, we still have to take those forecasts seriously. Having said all that, I think that each one of us knows the basics, and that is that when you're too close to somebody else, it's a good idea to wear a mask. If you've got a cough or a cold or a sneeze, good idea not to go to work. In fact, essentially you don't go to work. You should be washing your hands, doing all the basics that we've learnt in 2 years of a pandemic. And what we know from overseas, this pandemic hasn't gone away. It's well and truly amongst us. Some people, I think, are kidding themselves that it's not around. Of course it's around. So if some schools want to take the views, but some businesses want to take the views that they want to encourage greater use of masks in various situations, or some of the other measures that we know are effective, good on them. I congratulate them on that. But it would depend on where you are in the state, or where you are in the suburbs, a whole lot of factors. We know that there are areas in Sydney, for example, that have a higher apparent circulation of COVID. In some of the regional areas, it's relatively low at the moment. So the risk factors can be weighed up, I think, by each of us and determine what we want to do. And schools are welcome to do what they should do.
Just on the self-reporting, do you think the daily numbers that are coming out at the moment, do you think they are vastly under what the reality would be?
Look, I've asked Health to look at that and to see what we can see. There might be, there could be a range of reasons why we're not seeing necessarily all the cases at the moment. I don't know what the answers are yet, but it does seem to be a slight mismatch between what Health is actually seeing in terms of rapid antigen tests and PCRs, and of course what is being forecast by the University of New South Wales. So, but I'll go with caution, and I think that all of us should. It's worked pretty well for us the last 2 years, being cautious, and I think we should all be cautious. If we go to a show, we go to a movie, we go out, and we're too close to people, wear a mask. Particularly, might I add, if you're immunocompromised. The other thing I'd say is it really does worry me that, and it should worry the individuals who haven't actually gone out and got their boosters, but there's roughly about 40% of the eligible population over the age of 16 who have not gone and got a booster when they could have. Seriously, a pandemic, we know that people, almost everybody by now who would have thought that it was a great idea not to get vaccinated would have experienced, if they've got any friends or family who are in that situation, and they do tend to be in aggregated groups, they will have found that they'll have family and friends who got the virus and have been knocked around. It's about time everybody got real and went and got vaccinated and got their boosters as quickly as possible.
Is it still the case that New South Wales Health isn't giving advice that some restrictions should be brought back in, or some?
No. Well, it goes back to the issue that you and I have talked about 1,000 times, Ash, and that is Health last week had a preliminary advice to me off the back of the early UNSW work that said that they thought that we should be probably going back to masks, no dancing, no singing, and what I've said is I want to see the facts and figures before we even embark or consider those sorts of issues, and I want to also know what the rest of the health team is saying, that is those who care about the mental health issues, those who care about the cognitive development of our children who've missed out on school for a couple of years, and generally for just what the population is able to accept at this point. Because I think, putting it bluntly, most of us are over the last 2 years where we're wanting to learn how to live with this virus, and those who have more challenges with immunocompromised, perhaps they're undergoing treatments, well, they will be taking cautions. I have asthma. I take cautions, wear masks if I think that I'm in a situation which is particularly dangerous or particularly more risky. I think that's just where we're at the moment. But look, not ruling anything in or out. I think the Premier said the same thing. We need to get more advice and to look at all the issues before we rush back down those sort of paths. Sure.
Do we know what the mix of BA2 is in the PCR tests at the moment?
Well, it wouldn't just be the PCR. Oh, well, it would be in that sense because that's where we... Okay, I'll ask Dr. Gale. Thank you. What's your name? Nice to meet you, Phoebe. Dr. Gale.
Thank you. And just to clarify, I heard your question, so it's about the proportion of BA2? Yeah, look, thank you. So we're still looking through all of that data and to confirm the estimates, but essentially what we believe will be the case is that probably in some weeks from now, BA2 will be by far the dominant strain in New South Wales. And that's why, as the Minister noted, all of those precautions are very important for us to take and really strongly encourage the community, particularly around boosters. And as the Minister said, if you have not yet had your booster and you are eligible, And particularly I'd like to encourage people who may be at risk of severe disease, and that includes if you're over 60, if you have any chronic health conditions such as diabetes or liver disease or renal disease, and you haven't had your booster, now is a very important time to get your booster. And similarly, for anyone in the community who lives with or comes into contact with anyone at risk of severe disease and you haven't had your booster, please go and do that. In addition, all the usual measures apply, and it's time to redouble our efforts in that regard. And as the Minister rightly pointed out, you know, if you're in an indoor environment where you can't safely socially distance from others, do wear your mask. So as we see BA2 likely to become the dominant strain, it's really important time for all of us to focus on those steps that we can take to protect ourselves and to protect our families and to protect the community.
Dr. Gale, what are the diagnosis about the post-flood, post-storm pollution that we're seeing in Sydney? What's the warning about the risk of going into the water now? I mean, blue skies, sunshine, it feels like it was days ago, but what's the risk of still going into the water now?
Yes, look, thank you for that question. And really on that matter, I would rely on the advice from our local councils around the safety of the water and our relevant water authorities. But clearly, after floods, there are a range of different risks that can be posed to the health of people, and it's a very important time to pay attention to the public messages and heed that advice around potential risks after floods. And they can include, you know, making sure that the water you're drinking is safe and that it's properly treated, that your food you're eating has been properly prepared, everyone, you know, to take special attention to proper hand hygiene. And we know that after floods, many people may have had cuts and abrasions, and it's really important to treat wounds very carefully as well to avoid any infections. So after floods, and for any communities affected by floods, there's a range of measures that we need to take heed, including for swimming in safe water. And I just strongly encourage everybody to listen to the advice from health and other authorities around taking those measures to make sure that yourselves and your families are safe.
Can I just ask you, from an education department, how do you think it is going so far with the COVID plans and with the uptick? Are schools coping? Are there enough teachers to fill the backlog? You know, from your perspective, how's the plan going?
The plan has been working very well. Our schools have been really resourceful in making decisions that draw upon the expertise of all of the staff within the school. We have had the extra layers of some of our non-school based teachers being available, and we've supported our schools with a coordination point for schools and our directors to identify additional staff who can come into the schools and ensure educational continuity. It is complex, and certainly the impact of COVID is being felt, but to date our schools are managing really well in what is certainly complex, difficult circumstance.
There are teachers in Western Sydney who are protesting today just about teacher shortages. Is that a justified grievance? That they have been talking about this for quite some time?
We certainly have been across the fact that nationally, not just in New South Wales, but nationally and indeed globally, there has been a real strain on teacher supply. So we understand their concerns, and absolutely as a system we are working with a very strong strategy to increase our recruitment. We have certainly increased by I think it's about 3,000 teachers in the last 12 months being employed to make sure that we are replacing any who are retiring. But in some subject areas we need to be more strategic, and we have a range of scholarships and incentives to make sure that we can get teachers where we need them most.
There is one school I think it's in Queanbeyan that might go to a model where there's learning from home from some days just because of COVID and teacher shortages. Is that widespread, that we're not in a model that we need to look at that across schools?
Yeah, no, the learning from home model isn't being used as a result of teacher shortages. Where we might turn to a learning from home model, it will be for a cohort where we are seeing an increase in the numbers of cases of COVID, usually amongst the students. And we're seeing that most prevalent in some of our support classes where the students have particularly close contact with one another. So it's more in support of our students and minimising transmission rather than it being a teacher shortage.
Can I just ask about on the vaping issue? What lengths have schools gone to up until now to try and deal with the various issues that they're having?
Okay. Schools have certainly been looking for materials and resources to provide education to families and to students, and so that's why we welcome the New South Wales Health Toolkit. And schools have also been applying, as they would normally, their welfare, wellbeing and discipline policies. Vaping, like any smoking, is prohibited on school grounds for anyone. So schools are applying those same approaches, but very much a case by case. Students, as Minister Hazzard mentioned, do try things, they experiment, and so we definitely want to be able to provide them with the right information when there is a case of a student experimenting with vaping.
Reports at schools, some schools are locking toilets during breaks, installing vape detectors. Is that widespread? Is there a policy on that, whether the department says a school can do that they want, or whether that's something that might be looked at more broadly?
There is no policy on closing toilets. Many of our schools, regardless of vaping or anything else, during class time will minimise the number of toilets that are open, and that's a supervision decision. There are always toilets that are accessible to students throughout the day. So schools have not necessarily changed any of their practices directly as a result of vaping, more student safety at all times. We do not see that vape detectors are something that we wish to see in schools. It's not something that we actively support, and we also are concerned that some vape detectors also have video capacity, and we'd be very concerned about the potential privacy issues. Okay, thank you.
Can I just say, back on your question, we know when we've had big rains, the general advice is to don't go surfing, don't go swimming in the open ocean for a day or two. But when you've had a massive 1 in 100 year flood, you might be wise to not go surfing with parasites, bacteria and diarrhoea, because that's what you'll be copping in the waters up and down the coast. Any major flood and sewage outflows has the risk of Cryptosporidium, Giardia, a range of other parasites and of course bacteria. Normally you've only got to fight somebody else away from your break on the surf, but this time you might well be fighting off the parasites and diarrhoea. So just be careful. I suggest going in the water when it's clean, not now. Cool? Everybody? Okay, thank you everybody. What's wrong? Bye guys.
Nobody's getting in the ocean.
Yeah, don't go there for a while. Yep, okay. See you guys. Thanks, guys. Thank you everybody.